This time of year, one of the most common questions I hear is, what can I give my child to boost their immune system for allergies? So I want to gently challenge that kind of framing because allergies are really not a weak immune system problem. They're actually an overactive immune system problem. So today we're going to dive right in and talk about what immune regulation actually means and how it can help your kiddo. If you don't know me, I'm Dr. Ellie. My practice is Middle Path Integrative Pediatrics here in Asheville, North Carolina. And if you are in or around Buncombe County, then come and see me if you want holistic care for your kiddos or functional medicine for your kids or yourself. All right, we're going to dive right in. Okay, so why can boosting sometimes backfire? So in allergies and also sometimes in autoimmune and different things, depending on what we're looking at, the immune system is actually overacting to something. So, we kind of saw this also like with COVID, where you want to take like your supplements before, but maybe not while you have COVID, depending on what's going on and why you're using them and what the supplement is in particular. But it's like we need our immune systems to be in balance rather than either going crazy or in the case of like we're getting sick all the time, being deficient and actually not reacting as it should to like foreign invaders like germs and viruses and things like that. But in allergies, our immune system is actually going a little bit nuts because something like pollen is coming in, we're breathing it in through our nose or whatever, because we're outside and it's tree pollen time of year in and around our area. And so you kind of breathe it in and your body is like, oh my gosh, kill. And really, your body should be like, oh my goodness, that's a pollen, let me leave it alone. But actually what's happening is the body is like, foreign invader, let's go crazy and let's try and kill it off. And so what happens? There's something in your body called a mast cell. And that's just simply like a fancy way to say it's just a little tiny baby cell that makes histamine. And so histamine just kind of is like this thing that like makes everyone crazy in allergy season, right? It's like you get those watery eyes and that congestion and you're itchy and your throat is itchy and you've got the goo and the postnasal drip and you're just like, oh my gosh. The body's already reacting to this, like, what it thinks is a foreign invader when it's really just pollen or whatever it may be. And so it's overacting. So we need to kind of figure out how to regulate it rather than boost it. And this is why sometimes when we talk about boosting the immune system in allergies and certain conditions, it can actually backfire. So we just want to make sure that we understand that. I'll give you an example. I worked with a kiddo recently that had very large tonsils and adenoids. If y'all don't know what adenoids are, they're basically, I don't know, this is a major oversimplification, but I just basically explain them as like the tonsils of like the throat and nose. And they were really, really large and it was causing a lot of problems breathing. And this child was actually scheduled for surgery. And it is not wrong to get surgery if your child has like major obstructive sleep apnea, meaning they're like, not able to breathe at night, because that's very severe and that can cause a lot of problems. On the other hand, this child had not been treated with like a root cause approach at all. And so her mom was sort of like, well, is there anything we could do before trying surgery? And that's why they came to see me. And I was like, okay, well, let's see what we can do. And so we did her functional medicine testing, and she was actually super inflamed in her body. So there was a lot that we needed to do. We needed to change her diet because a little bit of like ultra processed food has snuck in, which is not uncommon nowadays. Everyone's living their life. Everyone's so busy and it's easy to just kind of miss it, but we just needed to clean that up a little. There had been some environmental toxins kind of going on, like near her house. Someone had been spraying like Roundup, like glyphosate, and that was kind of a problem. There were a few like chemical cleaners that had kind of snuck in and things like that we needed to get rid of. And on top of that, we needed to do some protocols for all this inflammation in her body by treating her gut, because if there's inflammation in the gut, there's inflammation everywhere. Okay. We needed to treat stress because as much as I love thinking that children have no stress, they really do, because things are stressful for kids, like going to school or playing sports or friend groups. Like that is it's just stress for kids, and I don't know if it gets easier when we're adults, but we like to think we can cope better, but I don't know. So we needed to address her stress levels. We needed to address her gut. We needed to calm down the inflammation in the body because her immune system was already like going crazy, trying to like kill gut infections. It was going crazy because her cortisol was high. and her adrenaline was high and her noradrenaline was high and all of these different brain chemicals that just kind of put her in overdrive. You can kind of think about like adrenaline being like that thing that happens when you're like trying to run away from a bear. That's cool if a bear is actually chasing you. But if you're just like out living your life and your body feels like you're being constantly chased by a bear, that is not good for the body. Okay. So we needed to clean all of that up. So we did all that in addition to some immune supports, some supplements and things like that, and some good nasal hygiene with like some xylitol nasal sprays and things like that. And her tonsils and adenoids actually ended up shrinking down enough that this child did not need to have surgery, which is amazing. I mean, if you can spare your child actually having to have a surgery, I mean, why would you not do that? I mean, of course. So if you're struggling with anything like that, definitely come and see me and see if we can kind of get to the bottom of some things. So what's the problem with boosting? So I think, a lot of parents kind of think, boost the immune system. And that's going to mean like fewer colds, less congestion, stronger, resistant to germs and things like that. But like I was saying before, in allergy prone kids, the system is already activated. You get this like IgE response, which is just an antibody that's like an antibody that gets kicked up when you have allergies. It activates these mast cells. It's like, hey, mast cell, do something. Mast cell's like, okay, I guess I'll do something now. Let me release my toxic histamine. And then the whole body is going crazy with this like inflammatory signaling. So adding stimulation to a system that is already reactive doesn't create balance. It can actually increase the noise. So allergy care isn't necessarily, well, it isn't about making the immune system stronger, but it's about like how to help it respond more appropriately to what's going on. So where do we start? So I don't start with supplements necessarily, okay? And we'll talk about that later when, might be the case too, or maybe even to use pharmaceutical medication. But where do we want to start? We want to start with the fundamentals. And if you guys have been listening to me, and I hope you have, and if you haven't, start listening because you need to know this. Supplements are supplemental, okay? They are not meant to be permanent. Is that a word? Permanental? Okay, but supplements are not supposed to be permanent. Yes, there may be like a few things that you're taking on the regular to keep your kids healthy or yourself healthy, but it shouldn't be a supplement stack of like 64 things or 27 things. I mean, unless you're really, really sick and in dire straits, or you're going through a protocol to clean up your gut or something. I mean, hopefully not 64 even then, but like there are maybe times that you're doing more, but it shouldn't be like I'm doing all these supplements for the rest of my life. And so how do we actually get to a point where we don't need all that stuff? We have to address the fundamentals. And it's not that like, exciting to talk about these things, but they're so important. So number one, sleep. Okay. So the best way to ruin your kids' cortisol and adrenaline levels is to have them not sleep well for a few days. And you all know this because if they're sick or they're like at a sleepover or, they've been studying late for exams or something like that, y'all know that they are not their best selves probably for a few days until things get back on track. And so one of the things that helps regulate cortisol, and cortisol is one of the things in our body that like helps us regulate our immune system and helps us with inflammatory signaling. The ways to control that is sleep. And so if you're not getting good sleep, you're just not sleeping well, and you do that for a long period of time. I'm looking at you, all of y'all people with newborns, okay? Everyone in that 0 to at least 3 month range. I know some of y'all are stuck there a little longer with the sleep patterns, but what happens is the following. So your body feels stress. Now, the body doesn't know the difference between the stress of like emotions in life and like, some kind of external environmental stress. So like, let's say, like taking a big exam or starting a new job, those things are stressful. And the body can't differentiate between that kind of stress and a physical stress. So what would be a physical stress? Not getting enough sleep, right? Or not eating well, or having a gut infection. So there's a lot of things that can cause this to get off balance. Okay, so the body feels this stress, either externally, internally, or often both, let's be honest, in this world. And we get stressed. So the body starts making cortisol, which causes an imbalance in the immune system, and adrenaline and noradrenaline, which we talked about earlier, makes your body feel like it's running away from a bear constantly, which is not good. And that makes your body feel what? More stress. So we kind of get into a cycle with it all, okay, where you kind of get a positive feedback loop. So the long story short is, if you are having like chronic sleep disruption, you are going to have increased immune reactivity. Your immune system is like, what's happening? I feel stressed. I'm going to react to something. I'm going to do something. It's not going to feel good. So if sleep is off, the immune system that's already reacting to the pollen starts reacting more to the pollen. And like we talked about before, you get those antibodies, those IgEs, that cause a histamine release from the mast cell, and you get worse allergies. So we have to address sleep. Now, I know what you're going to say. If I have really bad allergies, it's hard to sleep. Yes. And so there's some things that we can do to help with that. That said, if sleep is off for other reasons, we definitely need to get it back on. And y'all, for all of you guys that have teenagers, we need at least to be sleeping between 10 p.m. and 6 a.m. Now, you can sleep a little before or after. It's not that you can't nap until 7 a.m. or something like that. But because of the way our brains work, it is not healthy for the body for a long-term situation to be going to bed at like 2 or 3 a.m. and waking up at like noon. That can cause a lot of anxiety, depression, irritability, stress on the body. And we can talk about that more, but it has to do with the light signaling and the circadian rhythms that affect the hormones in our brain. So just a quick note on that. Sometimes it's not the amount of sleep. Sometimes it's the sleep schedule, especially in older kids and teens. Okay. All right. What else causes stress in the body? Has anyone had like a super huge like pancake breakfast out with like maple syrup and like the whipped cream, and what do they put on them nowadays? Like chocolate chips, like all of those things. And like you feel really buzzy for about, I don't know, 20 minutes, maybe you get an hour, probably not. And then all of a sudden you feel like garbage. Okay. This is because of blood sugar being unstable. So we have to address this. These kind of like carb heavy foods cause a lot of blood sugar instability because what happens? So you intake all this sugar, it goes into your blood, and you would think like, okay, that's fine, whatever, we can just stay there. Well, no, the body actually kind of needs it for its cells. So the whole point of having sugar is like, we're going to put it into the tissues and the cells, whether it be like your skin cell or your liver cell or your brain cell or whatever needs it to run. What happens from there is, well, let me back up. The way that it gets into that cell is your insulin goes up. So any of y'all that have like grandparents with diabetes or like have diabetes themselves or know of that, your insulin goes up in response to the sugar in your bloodstream, and it moves it from the blood into the cells. And that's actually a good thing in a lot of cases. And in a lot of cases, in a lot of ways, it's not. And that's a bit complicated for this talk. But the point is, because we're using this insulin spike to move blood sugar from the blood to the cells, we get a massive blood sugar crash. And what does that do? That signals to the body that we have stress. And stress does what? It causes our cortisol to go up, our adrenaline to go up, our noradrenaline to go up. It kicks up that inflammatory signaling, response. And so we don't want that. We don't want to be eating like a bunch of carb heavy foods and ultra processed foods throughout the day. And expect our bodies to run efficiently because they really won't. So one of the big things that I see in kids is either in teens, often they're running out the door without eating anything, Or we're grabbing like, I mean, no judgment, but it happens, like the Pop-Tart or the bagel, or just grabbing a granola bar, something to just like run out the door that has a lot of sugar in it. And you'd be shocked. Like a lot of those bars, you guys, you think they're healthy based on the marketing. Like you look at the packet and you're like, oh, great, like quinoa, like, I don't know, no sugar added, whatever. And then you flip it over and you're like, holy cow, there's like 14 packets of sugar in this. So be real careful with those bars. I don't know, they're not that great. Sorry, bar companies. Maybe you can do better. Bar companies, let's do better. Okay. You haven't gotten it right yet. And you know what? We're all allowed to not get it right because I don't get it right all the time either. So, how do we stabilize the blood sugar? We want to add protein. Okay. So, protein actually helps the blood sugar stay stable. Stay stable. That's really, say that 3 times fast. Stay stable, stay stable, stay stable. That's really hard. So, eating protein, breakfast, lunch, dinner, snacks helps stabilize the stress response. It's simple, it's really physiologic, it's not trendy, it's not sexy, but balancing our food throughout the day is really important. So, what does that look like in kids? Because a lot of people are like, well, what do I even feed my kids? This might look like a turkey roll up. It might look like hummus with veggies. It might look like, I don't know, for all of y'all meat eaters, some kind of chicken at night, some kind of like little chicken snack throughout the day. It could be, for the vegetarians out there, some kind of beans, which I actually love for people that are not vegetarian too. Edamame, like things like that, just adding throughout the day. And of course, you are not just eating protein. You're going to balance that with those micronutrients like your veggies and your fruits, because we also need, vitamins and minerals, which is another talk, but you need that to make other things happen in your body too. So it's not just protein, but we're balancing our protein with, our carbs and such, like our fruit. So let's say you're doing a breakfast berry bowl. You want to balance that with some kind of protein as well. Okay. So this is where you start looking at those fun recipes like chia pudding with a little fruit on top, or like some oatmeal that has like, almond butter mixed in with chia seeds and hemp seeds. Like this is how you can just like add the protein. Okay. Now, sometimes this has gone kind of not in the direction that we wanted it to. So you may have to take it slowly with your kiddos if they were used to eating like one way, or the family's used to eating one way. And maybe and this is, some people that I know that I'm close to, and they wouldn't mind me saying, grew up in families that were eating like a lot of junk. And that's how they learned, right? And we all learn from the people that we live with. And so it wasn't even clear to them until they were in their 20s that this wasn't like healthy. And so sometimes you just have to kind of go through your pantry and be like, whoa, like what are we even, what are we intaking? And sometimes it just happens the best of us, like Christmas happened or Hanukkah or like one of those holidays, and you just have stuff in the house and you're like, why do I even have this anymore? Just clear that out. It is not wasteful. I know that a lot of people worry about penny pinching, but trust me, diabetes, heart disease, all of that costs a lot more than that packet of like sugary bars. Okay. The next thing is reducing total inflammatory load. So we've talked about some things to already do to reduce total inflammatory load. One of them is those ultra processed foods that I'm talking about. So we want to keep everything in those, outer aisles of the grocery store. We want those veggies, we want those fruits, we want meats if you eat meat, we want beans if you're eating beans, we want legumes, we want all those good foods, and we want to keep out of that section that's got like the boxes, because the boxes notoriously not healthy. We want to kind of decrease chronic congestion. So I love using xylitol nasal sprays for this, just to start clearing stuff out, because sometimes there's kind of irritants in the nose that are kind of kicking everything up. So whether it be pollen, pollution, if you're at my house, dog dander. If you don't know this, I have 3 German Shedders. Well, I call them German Shedders. They're German Shepherd mixes. Well, one of them is an Australian Shepherd Border Collie. Anyway, sheddy dogs. And if we do not vacuum daily, it is a problem for breathing. So sometimes you have to kind of get that goo out. Okay. Addressing the poor air quality. So this can look like a lot of things in reducing inflammatory load. Sometimes it's as simple as just getting a HEPA filter for your kids' bedroom. It can also be making sure there's no like plush toys that haven't been washed in like forever, because it's so easy to have a literally a stash of stuffies that haven't been washed in like a year, because who has time to wash stuffies all the time? So if you don't have time to wash the stuffy toys all the time, it might be better to just kind of move them to a separate place in the house. And then whatever, stuffy is your kiddo's most favorite or most favorite 2 or 3, just make sure those are getting washed regularly, especially if they're going to be in the bed with them. Okay. Plush like carpeting in the bedroom for kiddos with allergy, that can be problematic. So either if you have the opportunity to get that out, or if it's a rug, get it out, or regularly vacuum it, clean it, whatever you have to do. Same with curtains. I'm so sorry. There's so much cleaning. Now that I'm saying it, I'm like, so much cleaning. But really, if you have a kid that's really suffering, like making sure curtains and things are getting washed is so important. Okay, environmental irritants. We want to reduce that too. And this might look at like, I'll give the example of where I like will walk. Sometimes I walk and there's like part of where I live, there's part of this like pathway that I take every day with my dogs. And it's like 3 miles long, but there's this one part that is like by the road and it's like busy and you have to wait at a stoplight and you're just like, the trucks are like spewing their whatever fumes at you. And it just feels dirty whenever I walk there. Probably not like the worst thing if it's like, okay, I'm in this spot for like 1 or 2 seconds, but if that like happens to be your whole walk, like you're walking along the side of the road, for example, that would be unhealthy. So I would change that and see if there's something better, like a park or, just walking around a neighborhood or something where it's just a little lower with the environmental irritants and toxins. Which brings me to toxins. I have a toxin checklist. I'm going to link that. And if you guys want it, you can get it. But it's just looking at all the things in the house that might be causing irritation. So the bleach and the Lysol and toxic cookware and lots of plasticizers. What happens with this, you guys, is it's not just like, okay, you did like this one thing. It's like the cumulative effect, the toxic bucket just like fills up and overflows. The inflammatory bucket then fills up and overflows because this is all related, right? So then you get this like spillover of the immune system just overreacting, and then the allergies are much worse. So think of it this way. If you've got toxins and you've got ultra processed diet and you have poor air quality and you're not doing good nasal hygiene, and you've got gut infections and you've got, stress response happening, that is when things are going to spill over and you start seeing a lot of kind of illness with that. I think the key point here is, you guys, if you have a child that you're thinking, oh my goodness, with allergies, do they need an immune boost? I think we need to kind of just shift the framework a little bit and just kind of think about like, what are the fundamentals that could be causing underlying inflammation? Okay. And if you have done all of this stuff, you're like, okay, their sleep is good. Their room has been clean. We've thrown those stuffies in the laundry. We've gotten rid of the, gosh, I hate to pick on like people's general foods because it feels so personal. And that said, you guys, I didn't grow up knowing all this stuff. So we all start knowing what we know. So I don't want anyone to ever feel badly that they're starting where they're starting or things have gone off track, because I'm also human, right? So we need to just sometimes make adjustments, and sometimes things go off track and then we get back on track. Okay. So that can happen too. But if you're noticing like, oh goodness, like we still have that Halloween candy and it is March and we're still like freezing, we've frozen the cake from Christmas and we're eating it at night. And oh my goodness, we've been cleaning with like the bleach and all of this, and it's just like toxic chemicals. Just time to like reevaluate and try and get some of that stuff out. But that said, if you have done all of that and you've focused on like cleaning up, the nasal hygiene with like the xylitol spray and all of that, then you should have the inflammatory load down enough that then you could consider what else needs to be done. And so what else needs to be done is you're going to need to do functional medicine testing. Okay. So functional medicine testing gets to the root cause of why your kid still has inflammation in their body. And oftentimes it's those things that I talked about. So gut infections. So what happens is we have some kind of stress on the body, like I said, from any of those different sources. Could be environmental toxins, could be just life, could be food, could be whatever. And the cortisol goes up and the adrenaline goes up and the noradrenaline goes up. And now what happens is the immune system's dysregulated and we start getting infections in the gut, and the gut causes inflammation. So you would not know, I guess, unless you're a functional medicine practitioner, I should rephrase that. If you're a functional medicine practitioner, you're going to know how to deal with that. But if you're not, you're going to need to come and see me so that we can do a gut test and we can figure out like what is going on. Like, do they have gut infections that we need to treat? Is their microbiome completely off balance? Do we need to look at an herbal supplement support for a short period of time in order to help them with their overall health and their allergies? Do we need to look at their detox pathways? Because maybe you've done so much detoxing and you're like, why do they still seem toxic to me? It might be that their body is unable to detox. And so sometimes we have to use supplements to help support that. So if you need all that, definitely reach out to me. Go to middlepathintegratedpediatrics.com and book a meet and greet. And I would love to help you. So when do supplements make sense? Like I was saying, again, if you're sitting there going, like, do I need supplements? Do I need functional medicine? Again, if you have tried all of these fundamentals and your child is still having these like moderate to severe symptoms, there may be like these deficiencies that are happening in the body that are very specific to your kid. There may be a need for like short-term antihistamine response support. We may need to address the gut infections. But all of these, again, you guys, we want to layer this on top of those fundamentals. And if you're not sure, you're worried, or you need support with those fundamentals, please reach out also, because we should never, ever feel bad for asking for help, because sometimes things are just not clear until you have someone who's like an expert. And I'll give an example. This is like me trying to do my own accounting. Okay. It amazes me how much time and dedication moms will spend on the internet trying to do their own kids' integrative and functional medicine. And kudos, because I have seen people who have literally almost gotten themselves a medical degree trying to figure out what's going on with their kids before coming to see me. But I will tell you, I would never try to do my own taxes because it would be a hot mess. And in fact, thank you, Jennifer from Canopy Whitney, if you're watching this, because I would be in dire straits, and me spending hours and hours on the internet researching tax law is not going to help me get where I want to go easily, quickly, without a headache by the end of the night, or like wanting to like vomit from like the migraine that I've now developed. So don't feel like you need to do this alone, you guys. You're not alone. There is support in and around where you live in Buncombe County or the outlying areas. Just book that meet and greet. But remember, in short visits, these insurance kind of based models where they have like that 10 or 15-minute visit, it's really difficult for doctors to unpack even any of those fundamentals if they do know how to even do that, because a lot of Western doctors are not trained. And it's just a different training, you guys. It's not that they're bad doctors. It's just a different training system. They know Western medicine, and that's what they were trained in. And that's great. And I'm offering, functional and integrative medicine, which takes another degree. So you have to get a degree in integrative medicine and functional medicine. Like your regular doctor is unlikely to know this stuff unless they've gone out and gotten extra training. So don't expect that, because then you might be disappointed. And you might get like a really short visit where they're just not even going to have time to unpack like the normal stuff, like sleep and nutrition and airway stuff and all of that. But they're certainly not going to be able to tackle like inflammatory load and toxins and recurrence patterns and things like that. And that's why we need to do a functional medicine program, because we need time to unpack all of that. And it takes time to unwind and unravel all of these little pieces that have been going on in the body for so long. It's not something that, within 10 minutes, like if you were to take a Zyrtec or something, that you're like, great, my nose is dry. Well, that's cool, that your nose is dry, but have you addressed any of that underlying, stuff? Probably not, right? So those patterns matter, these recurrent patterns. And that's why when I see a child with like springtime congestion, fall time congestion, they're having it every year, they've got enlarged tonsils, they can't sleep, they're getting infections because of the congestion from the allergies, I'm thinking about immune system regulation and not just symptom suppression with something like an antihistamine like Zyrtec. And it's not wrong to treat your symptoms while you're treating the root cause. It's just that you have to kind of know you're going into it suppressing symptoms, okay? That said, there may also, once you've done all this, there may be a place for something like allergy shots and things like that. It's a lot for kids. So that's another topic and definitely something to chat with your allergist about. But that is something to consider once you have taken all of these steps, okay? Because it's a lot of things. And as you guys know, how many people want to really take their kid for shots on the regular? Yeah, me neither. I don't have kids. I have 3 dogs and I hate taking them for anything, even their nails being trimmed. I mean, let's be honest. My one dog, Liam, oh my gosh, you would think he was just getting run over by a car getting his nail dremeled. So okay, so you guys, for families here in Western North Carolina who are dealing with recurring patterns like this is exactly the kind of this is exactly the kind of longitudinal care that we focus on inside our membership model at Middle Path Integrative Pediatrics. You're going to have those longer visits. You're going to have seasonal prevention planning. You're going to have follow-up and adjustments, because immune system regulation isn't just a one-time conversation or a one-visit conversation. You need that longitudinal care. So if you take one thing from today, let it be this: allergies are not a signal to boost harder. They are a signal to calm and to regulate. So next week, we're going to talk about how allergies, eczema, and ear infections are often all connected. So stay tuned for that. I'm wishing you guys well. Again, I'm Dr. Ellie from Middle Path Integrative Pediatrics here in Asheville, North Carolina. If you live in and around the area, book a meet and greet. I would love to meet you and see how I can support your child with allergies, gut health, inflammation, and all of that good stuff. Check it out. Wishing you well.